Well, now we go to new research regarding breast cancer treatment and what it may mean for women making surgery choices. Joining us now is ABC medical correspondent and our friend, our favorite doctor, Dr. Darien Sutton. Nice to have you, as always. So pretty much everyone knows someone affected by breast cancer. And this new study is looking at the different ways women are treated for breast cancer and the outcomes. Break this down for us.
So this study is focusing on the surgical procedure of mastectomies. That's technically the surgical removal of breast tissue. The goal is to reduce the risk of a new diagnosis of breast cancer later on in life. Some women, 100,000 women, are undergoing this procedure each year, some women choosing to do the more aggressive approach of removing both or bilateral breasts. And this study looks to see what is the benefit in that. It found that although it reduced the risk of breast cancer, it doesn't change the overall survival. In this study, they followed more than 300,000 women with the diagnosis of breast cancer, and they looked at those who chose different options. And for those who got a full or bilateral breast mastectomy, they found that they did have a reduced risk of breast cancer, but the overall survival among all groups was relatively the same. Now, these are important, but it's also important a factor to understand that women have different risk factors, and this wasn't truly considered in this study. So when you're making that decision, it still comes down to that patient and their provider.
So what does this study mean for women who are newly diagnosed?
Well, I think number one, the option and the understanding of a mastectomy is a personal one. It is unique and it is complex. And when you're making that decision, you should take into effect all of the other risk factors. For example, genetic history, family history, a personal history of cancer, even a prior history of radiation. And then that goes into that decision, weighing up against the risk of surgery. Again, it's unique and personal and complex for each and every person, and there is no wrong answer. Rhiannon, I think what's most important is that regardless of your decision, you make a plan for proactive screening of all cancers after that. And you want to make sure that you're staying up to date with all recommended screenings.
All right, very important information. Is it surprising?
It's not surprising. I would say that the risk reduction in terms of risk of breast cancer reducing is surprising or helpful to know, but the actual risk of death is not. And why? Because mastectomies, although they remove breast tissue, they don't prevent the risk of breast cancer cells going to other parts of the body. And so when we know that, then that understands the risk, or that creates a risk for a woman in general. So we have to pay attention to these factors.
Have to pay attention. Dr. Darien Sutton, thank you as always. Always a pleasure.